There have been a lot of sort of big groups that we had to tackle as we've gone through CultureCare here at Tampa General Hospital. Probably one of the easiest groups starting out was the senior executive team, because our CEO was so on board with this idea, and I mean, ultimately he had put together this incredible strategy for the next few years for our hospital, and so we sold him on the Peter Drucker quote, "Culture eats strategy for breakfast."
There was no definition of, okay, what do we have to do differently if we're going to survive in the changing healthcare environment. And so the board recognized that and developed a strategic planning committee and brought in an outside consultant to work with the committee and the leadership that was here to develop a strategic plan for the next 5 years. And it just seemed to me that the things that are in the Speed of Trust seemed like to be a natural way to make the strategic plan accelerate. And so this seems like the perfect vehicle to do that.
One of the biggest questions that people have asked, from the very beginning, from the chief executive all the way down to staff members, is, are the physicians going to go through this as well? It's interesting because one of our biggest advocates in this process bringing CultureCare to Tampa General Hospital was our Chief Medical Officer, Sally Houston. And because of that, because of her support, we were able to right away capture a large group of our physician leaders.
I think the Speed of Trust is really important, and one of the conversations that we had before we made the decision to go forward with this was, we have so many things on our plate right now. We have so many competing priorities. How on earth are we going to find time to do this on top of everything else we have to do? And I said, if we can do the Speed of Trust, it's going to make everything else we try to do easier. So I think that with all of the changes in healthcare, we're really running fast to try to keep up, and not only keep up, but get ahead. And I think that having these tools and improving our working relationships will help us a lot with the objectives we have ahead of us.
The culture is going to change dramatically, and CultureCare was our way of being very intentional about how that culture was going to change.
First of all, I think about culture and the need for culture change in healthcare, and especially in what I'm doing and focusing on in the quality initiative. It's well known that healthcare needs a culture change to look at what we do differently from a quality perspective.
One of the biggest things that we realized at Tampa General Hospital is that we really had hit a plateau when it comes to patient satisfaction. Despite all of our efforts, having a patient satisfaction committee and being very focused on it, offering incentive packages around it, we really got to the low 70s, so not even the mid 70s. We were in the low 70s in a lot of categories, and we plateaued there. So part of what we're really hoping that CultureCare is going to help us do is to bring those numbers up. We're getting great feedback from all areas, in terms of how people feel like this is helping their ability to impact patient satisfaction.
I think the idea in bringing CultureCare here was to look more at our patient satisfaction. What do we need from, what do our patients need from us, and what do we need from each other in order to be able to accomplish the goals and raise our patient satisfaction scores to the highest possible level that we can.
Right before we started this process, we got a baseline for what our employee engagement was at, and across the board again, we really weren't where we wanted to be with employee engagement. When we presented those results to our leadership staff, we actually immediately made the connection between employee engagement and trust, because there's all kinds of research that shows that if you can improve the trust that employees have in the organization, it's going to impact engagement, which we also know then has a direct line to impacting patient satisfaction.
In order to change that, change the culture and think differently about that and think about preventing things and improving outcomes, it's really important to have an environment of high trust. And that's because no one person can make those changes on their own. It really takes efforts of multiple people. We have very complex patients and complex systems, and no one person can control it all. So we have to trust everybody in the room and everybody in the system, everybody in the organization to do their part so that all the pieces come together and that we improve outcomes that way.
It was my hope that the Speed of Trust would actually improve our trust among departments, among leaders, among our peers, so that we have quicker decisions to meet the business needs of the patients in the hospital. And we have seen that. We've seen committees, meetings be trimmed back, decision-making being pushed down to lower levels. It has quickened our pace and our decision-making.
We use the Press Ganey Employee Engagement Survey, and there are actually 9 questions in that survey that relate directly to safety, patient safety. CultureCare is going to allow us to change those numbers so that when we do a pulse check in another 6 months, we expect to see that number drastically change. People really feel like we've given them both the language, the tools, and the skills to address things that have bothered them for a long time but that they haven't known how to address. And so we've gotten a lot of great feedback, from all levels of people saying, this is exactly what I've been looking for. I needed to have this conversation with my manager. I didn't know how. Using these tools, and we've actually heard staff members say, when I took the cards out, I saw, the leaders to meter completely change because they remembered CultureCare is where we're going. It's what everything is about now, and it really changed the way they handled difficult situations.
One of the areas that we sometimes have some friction is the relationship between the physicians and the nurses, and I think that what I've learned about Speed of Trust has given me a framework for having some of those difficult conversations.
We've talked about how, as the Speed of Trust has rolled out, it has given us a common language to use amongst ourselves, but even amongst the people that we deal with and who are most important to us, the patients.
If people are comfortable having difficult conversations with each other, I think we'll have fewer adverse events for patients. I think that we can improve the care for our patients, and then having more empathy for our patients and having that trust with our patients and the families, that's obviously going to help us with our patient experience.
The Speed of Trust helps patient care at all levels of the organization, from IT, environmental services, nurses that take care of our patients, physicians that take care of our patients. Everyone benefits from having predictable behaviors with each other, positive behaviors that reflect directly to our patients and ultimately lead to better patient care. We know what to expect of each other. We're extending trust to each other, and we're seeing higher levels of performance.
One of the things that I've observed is that as Speed of Trust has been rolled out in the hospital, that in my mind, it's all about, I like the word alignments, and it really is aligning the goals and objectives of the hospital in wonderful ways. There is excitement building about Speed of Trust in the organization, and that's clear. We've had successes already.
So the culture at Tampa General Hospital has been changing because of a variety of things. The biggest one being that the healthcare market has changed so much over the last few years, and it's going to continue changing. Some of those changes we're really certain what's happening, and other changes we still don't know what's going to happen, and it could change every 4 years. And so we really needed to get to a place where we could deal with change more quickly, and that's probably the biggest things that CultureCare has done for us, is it's really given us a process to start building the trust between groups so that when we do need to change based on the market, we're able to make those changes more quickly.